filter in, and that's just fine. It's beautiful outside, so let's take advantage of getting you out for some more sunshine today. I want to start by telling you that if you need a restroom, off to the corner there's a doorway. There's restrooms there. If you go back out just before the office, there's also some restrooms right there. So let's go ahead and get started, okay? So I'm really honored to be here at St. Odelia. This is the second session in a 6-session series that we're doing. We'll take the month of December off, but I'll be back again in January. And I want you to know that we would encourage you to share this with others. Last time we had 30 people present, 20 people live streamed it, and we've had over 180 that have watched it online. So that's what we're hoping for. We just want this information to get in the hands of people. So know that the website here at St. Odelia has this on there, and they'll continue to gather these handouts that you're getting on there. So you can refer people to hear these later and get this information later, okay? All right, so I've been a registered nurse for 41 years. Of that, my career has been 20 plus years just in dementia. I had the opportunity to work pretty much in every area of nursing. Hospital, home care on a ventilator patient, intensive care unit, float pool, spent a lot of time in the trauma ICU, the OR pre-op, did some post-op work, and then I was a nurse at a church for 9 years. But the brain has always been something that has been of great interest to me. And working with a group respite program for 15 years taught me a great deal. So let me go in and share some of what I've learned from the training I've been able to go through the state of Minnesota, through Teepa Snow, who is a well-known dementia educator that people get a lot of her educations online, but also through my training of volunteers. We had at one time, we had 300 volunteers across the metro working our programs. So I'm going to share with you, you'll see it in your handout, so don't worry about it. You'll get to it, but you'll have the link to be able to get to the previous offering that we did, okay? All right, so let's jump into the meat of this. I have a couple things. If you could go on to the next slide. Thank you. I have a couple things that were asked of me, so let's start with that. Someone asked, could you differentiate between Alzheimer's and dementia? First of all, I want you to know that dementia is an overarching term. It's kind of like the category of vegetables. It's just a category, okay? But Alzheimer's is an actual dementia. It's a diagnosable dementia. Alzheimer's disease is 60 to 80% of all dementias. There's 3 others that are most common, those being Lewy body, vascular dementia, and frontal temporal. There's many others, some say up to 100 or more dementias of various kinds. But if you're interested in knowing more, listen to last month because I went into specifics on that. But just so you know, Alzheimer's is the most common of the dementias. The next thing that I wanted to do was to let you know that you can help someone who's living with dementia to have joy on their journey. You can help a caregiver, a family that's deep into caregiving, to have joy on their journey. You have an important role to play as an individual, as a family member, as a friend, as a neighbor, as a member of your neighborhood, as a member of your faith community. And so I'm giving you a lot of tools today that will help you. This is different information than what we'll do in 2026 on metropolitan resources that are available for you, okay? So I want you to know that less than 50% of people ever receive a formal diagnosis. Without a formal diagnosis, you can kind of live in the fear of, I'm not sure what this is. But also, you also don't know what to look for to know what resources to obtain. And being unaware and left unprepared is what one of my goals, as well as all of us that do this work across the country, this is our goal, is to help people to be prepared. Did you know that of those that are diagnosed, the diagnosis is often delayed 2 to 7 years after symptoms begin? That means they have significant impairment by the time it's recognized, and unfortunately, often it's a crisis that leads to a diagnosis, and often, therefore, an urgent need for a change in a level of care. I'm going to add to that, and when there's been a delay, 2 to 7 years means that the individual who has these brain changes has had a missed opportunity to say what they want for the type of care that's ahead, what they might like to do as a volunteer before things change. So there's a lot that we miss when we don't get that diagnosis early. And you and I, those that are listening online, we need to be a part of changing that narrative. We've got to be a part of making these facts known and dispelling fear, as well as changing stigma. And that is very real. With 3 parents with dementia who no longer are living, we felt it. So I want to go to the next and just back up on a couple things that I addressed last time, but I was speaking out of I'm not positive, so now I want to clarify it. So the next slide will help us. I mentioned the genetic predisposition to dementia, and there are 2 different things up there, the ApoE4 gene test and the APP. The ApoE4 is that late onset, so it's those that are diagnosed 65 plus later in their years, and late, normal is to be diagnosed after age 65, so late would be further than that. But the young onset is 30 to 60, and that was the one with the APP. So I just wanted you to hear that there's genetic testing that isn't done on the average person. It's more where there's familial tendencies, where you can see a great percentage of a family is having this occur over and over in their families. So most experts don't routinely recommend this. The one that they recommend is more so for the young onset. In the news, and time has a way of melding together for me, but it's been, I'm going to guess 10 years ago or so, there was in the news about a family in, I think it was Guatemala, that had all of their adults by age 40 had Alzheimer's. Okay, so now are you catching the impact that that's the family that would have the APP testing? Okay? So the other thing that I want to remind you, genetics we can't control, but I want to take you back to all the things last month that I talked about with lifestyle. So you have choices, and they are very, very important. If you could go to the next slide, I want to talk about these things that I didn't mention last time, and they have now come up as significant. Your gum disease and chronic oral inflammation is affecting your brain. So dental care, twice a year or more, critical to get on top of gum disease. And also, well, it says on there, the routine oral hygiene. So please take care of that. All right, the next thing that we're going to look at again is this checklist that I've often recommended for people to utilize. They have it in copies for you in the back to pick up. This is something that I have sent to hundreds of families. And I love this particular form because it gives you, it's all on two front and back, and it gives you lines to write down things that you're noticing changes. And that form can be shared with the doctor ahead of time, so they see what the family, what the friends, what neighbors are recognizing for changes, okay? So this is important for you in your role with friends, neighbors, family members. So why is a dementia diagnosis important? Truly, it is often the case that when we can get the earliest dementia, and dementia is not, again, that's like saying the earliest vegetable diagnosis, right? It's a category. But the earliest we can get an Alzheimer's or a vascular dementia or a Lewy body or a frontal temporal diagnosis, the better. And you might think, why? Because I'd rather push it off as long as I can. Believe it or not, those that get diagnosed earliest get more resources given to them. They start to get their life things in order that they want to have organized. And believe it or not, they stay at home longer. How many of you, that's your goal, is to stay at home as long as possible? So don't you see that this is one, we've got to get this information to people. And so we want to maximize their time to make decisions, to plan for their future, access services and support early on, reduce their risks. Often it's because of the risks that the family may move them out to a different facility way too early. And it's out of care and concern. But anyway, we want to reduce the risks and make maybe a more timely decision on things. Prevent or reduce future financial costs, improve clinical outcomes and medical management, and we want to be able to help neighbors and community members to be able to guide them in helping. All right, the next thing is, how can you help a person living with dementia? Well, first of all, you might say, why did she continue to be a friend? But it's quite common that the friendship circle falls off as a person goes through their dementia journey. Having 3 parents that had this, having 2 first cousins that had this, I will tell you that a lot of times it's out of fear. People are kind of afraid to see this happening to their good friend. They're afraid it could happen to them. They don't know what to say. So what I will tell you is that by you taking the time to just continue to be with your friend or your family member, even if it means playing the game different. So I have a good friend that I play Mexican train with. We no longer keep score, and I choose when I want to bend the rules and not win when I'm supposed to win, because we're just playing it for fun and we're playing it for her cognitive stimulation. That's the goal of the game now. So revising the rules of what you do together is totally fine. Winning is not your objective. Also, can you enjoy activities to keep them going in the community? So I'm going to give you some examples in just the next slide, but wait, don't go there yet. The next is, can you listen to them? They may want to talk about what's happening to them. They may want to tell you they don't like how they're feeling right now. A lot of people starting in a dementia journey will not have insight into changes, so don't expect them to know. But if they want to talk to you about it, when we ran a program in Minnetonka, I had 3 or 4 gentlemen that were in the early stages, and they wanted to talk about it. They wanted to talk about what was hard for them. They wanted to talk about what they could do, and they drove until they couldn't drive. With the diagnosis, they drove until they could no longer drive. They also traveled to Washington, D.C. to make a difference with the legislative efforts. So they really were walking the walk and helping people to understand. But don't say to them, oh, you don't have Alzheimer's. Oh, you don't have vascular dementia. That actually, you might think you're comforting them, but what you're saying is all those months of going to those appointments and having all that testing doesn't mean anything to you. You don't believe it. They've been diagnosed. Believe them, support them, listen to them, have empathy for what this means to them. They need your support. They need your listening ear. And I don't know your roles. Each of you are here playing a different role, but you may need to go to appointments with them. And think about another way you might support them. And if this is your good friend, it's possible that early on there's not a ton of caregiving going on, but is it possible that their partner, their spouse, their sister, whoever's their caregiver, could use some support as well? Okay? I have another slide that we're going to continue this, but these are some simple things to be thinking about, but compliment them. Why do I tell you that? Because the reverse is you could criticize them, and do not do that. Their self-esteem, their looking at themselves is already being challenged. For you to say, oh, for Pete's sakes, I told you that 20 times today, is not helping them. You're the one with the brain intact. It's up to you to figure out how to work with them without belittling them. Okay? You want to build in extra check-ins for safety if the person lives alone. You want to provide reminders in writing. Now, you may, with my chronic long COVID, I have Post-it notes everywhere. So, but that is a really helpful tool for people with dementia early on, is those Post-it notes. Or the smartphones that people have already been used to using, put reminders on that so it pops up reminders. So there's lots of great ways to do these reminders. What about for those that are more stressed by choices? Simplify choices. Do you want this or this? Do you want to wear this or do you want to wear this? Instead of taking them to Perkins with, 6 pages of a menu, print off or write down some of their favorites, hand it to them and say, which of these would you prefer today? I want you to reassure them, adding humor whenever possible. Okay, do any of you know the science behind laughter? Lots of serotonins, endorphins. These are free chemicals your body produces. They're powerful drugs to your body. They don't cause side effects. It's non-pharmacological. Utilize them. Laugh as much as you can, whether it's reminiscing about funny things you did in your past. I don't care if you talk about the same thing every time you see each other, as long as you're finding opportunities for laughter. Allow them to reminisce and tell their stories. So with our volunteers, for quite some time we had one-on-one, a volunteer for every participant. And it's gone to being 2 participants to a volunteer, but still the same thing is true. Listening to the person's stories are critical. Now, us in our programming, we had people for sometimes a few years. Yes, we hear the story over and over, but we also saw as the stories started to decrease and the stories went away. You need to learn their story so you can tell them their story, because what you will see is a person that goes from this to sitting up straight and beaming and smiling because you know their story. So listen to them and allow them to reminisce. Validate them. Be on their side. Often, mornings and early afternoons are best, and I'll go into more on that. For some people, sundowning can occur. The next slide will talk about interacting with people, and this, again, is kind of a simple list, but it's helpful. Can you, if the person isn't as communicative as they were before, can you look for questions that you can ask that are yes or no responses so you can engage them? Can you give them time to respond? Always avoid arguing. I'm going to tell you, I don't care how early in the dementia journey they are, you're not going to win by arguing with them. You can validate till the cows come home. I was raised on a dairy farm. I actually know when the cows come home. But you truly will not win. So why go there? Just take them from what their story is at that time. If my dad had been talking and his communication was telling me that he was kind of, at that moment, living back in the 1970s, I needed to go back to the 1970s with him and reminisce about that time and ask him questions about that. Tell me more about your mom. Tell me more about farming with your dad. Instead of saying, oh no, you told me something different at one time. Who's going to win with something like that? No one. So don't do that. Now, I'm going to help you see some dementia-friendly principles on the next slide, and I want you to tell people about this. So if we can go to the next slide, there are things that are available for you. You can either go online to the link that I provided to Dementia Friendly America. They have sector guides, so they have a faith community guide included. But there's many, so businesses have guides in there that they can go through, and I think it's like an hour training. The Dementia Friends Minnesota is where they will bring a trainer out to your group, and it's a 90-minute training. Both of them are excellent. And I highly encourage you to consider how you can bring those into your community, whether it's your Bible study, your faith formation group, a Sunday school class, whether you have a coffee time with neighbors where you think that this could be a service project that you could work on. But I really want people to hear about the Dementia Friends, Dementia Friendly America and Dementia Friends Minnesota. Okay, the next thing I want us to think about is how we can help a caregiver. So is there anything from last month, is there anything from today that you can share with a caregiver? Please, please, please share away. We'll also have 4 more coming in 2026, January through April. Again, share those resources as many times as you want. So the next is, can you offer to sit with or do an activity with their person while that caregiver takes a break or goes to an appointment? If you don't feel comfortable being in their house without them, you could always offer to go with, right? So is there some way you can be an extra arm to that caregiver? And it doesn't mean that you offer it more than once, but can you at least be there in some support? Listen to them. Is it possible to take a meal to them? Can you organize help? Now, I've given you several different websites, lots of Helping Hands, Meal Train, Caring Bridge, Care Calendar. If you've not seen these, they're really good, and they can really be helpful. I'll tell you, I kind of giggle because in the 9 years that I was a parish nurse at a church in White Bear Lake, we could have, I don't know that Meal Train existed, but a good friend of mine, her husband passed away, and people were so good. She had so many meals delivered. But I want you to know, what was the #1 meal she received? Lasagna. Over and over and over and over and over. And maybe Meal Train would have given us a place where people could have registered what they were bringing. Does that help you to see where something like this could be a tool? All right, this is something that I really want to get out. The next slide this is quite new information. There's paid leave in Minnesota now for caregivers up to 12 weeks. It's a new law that AARP Minnesota helped to champion, and it's for those working caregivers and their families. And it's in order for them to take up to 12 weeks off from work paid to help someone in this dementia journey or recovering from a serious health condition. It does offer job protection and partial wage replacement during that leave, and it covers the caregiving for a family member when medically necessary with certification from a healthcare provider. So that means that my primary doctor would have had to have written on this form that I was taking a leave to take care of my mom, okay? But I've given the link to get to this site and the phone number if people have questions. So if you know caregivers that are working and they're kind of at the end of their rope, please let them know about this paid family leave. Another resource that you may not know about, and Tom Hayes from St. Odelia is on this group. I was on it for a long time, like 13 years, but they do wonderful work. And that's from the city of Roseville. It's the Alzheimer and Dementia Action Team. And their website is full of a lot of resources and a lot of past presentations. So I want you to see just a spattering of some of the things that they have on that site. Okay, the next slide is from that group. One of our members worked with Silvercrest, and they had these staycations. And I said, we've got to get the word out to people about these. So if you go on there, you can see all the places that they actually have a form. And if you click on that, you're going to see what the Norway House has available. Do they have a wheelchair for you? Do they have easy access to restrooms, elevators to get around? Do they have some type of a form that you can pick up from the information desk to ask a few questions or exhibits that you want to go to? So this is really helpful. They used this for going on some of the trips with people from their buildings. And so these have already been vetted. So take advantage of that, okay? The next slide we're going to talk about is if you have someone that you're befriending that's a caregiver and they are really, really struggling, you may wish to give them the names of these agencies, and I'm just listing a few of them this time. I'm going to go into great detail at the one that we do, Metro Resources, but I wanted you just to have a few so that you can at least send them to some place where there's dementia support groups. And a lot of support groups have gone online in order to help caregivers caregive from home while they're doing the support group, because too many can't get away to leave their person and go to the group. Memory cafes, if you've not heard of them, I'll talk about them more, but memory cafe is where the caregiver and the person with dementia go together. They start out together socializing with the group, and every memory cafe does it differently, but at some point in time they often will split up and go into two groups so the caregivers can have some time to talk together, and somebody is helping facilitate conversation with those that are living with dementia. So just the short list to get you started for now, okay? The next thing I want you to know about, if you've never heard about it, here at St. Odelia, they have been doing this since before COVID. And it's their memory care mass. They do it on a monthly basis. It's done monthly, but every other month here, and then the opposite month at St. Mary of the Lake in White Bear Lake. And I told this story last time. I'm going to tell it again because I love it. I was at the one at St. Mary of the Lake, and I know that the family has come here as well. It was 4 generations. And the granddaughter with her baby, she came up to me as we had just left just before the memory mass started. She came with tears and said, "This is so important for us. My grandmother has not been to a mass in 23 or 24 years. She had a head injury that made it so that she was not able to go." This is where people with dementia are accepted for who they are, and they are welcome to come, and I'm not saying enough, so I need to clarify that. Sometimes people with dementia might not be able to sit still as easily. They might need to get up and stand in the back. They might need to get up and walk around. They might talk and hard of hearing becomes more and more of a problem as we age. They might talk too loud. That may not be something that the caregiver has brought them to the faith community masses for, but to go to this small group once a month. So does that help clarify? I want you to know it's a very dignified, wonderful experience. Tell others about it. Again, the next slide is going to talk to you about respite services, but I am going to go into a lot more detail on this. But here gives you a few places, and what a respite is, that's the program that I worked with for 15 years. It was a respite where the caregiver brought the person with dementia, and for that day, we worked on cognitive and social stimulation. So it was fun, it was laughter, it was exercise, it was singing, it was working small motor, large motor. It really worked all lobes of the brain. One of our caregivers, she was an occupational therapist by trade. She said to me, she gave me a call after one evening of the gathering and said, "I will never miss a gathering day with my mother ever again. I don't know what you have done with her, but her brain juices are flowing. Normally I visit her and she sits in the recliner and she says nothing. Her cat's on her lap and we sit quietly during my visit. After your program, she talked and talked and talked." That is the intent, is to get that brain really working, get it fired up. What I talked about last month for what is good for all of our brains is also good for people with dementia. You don't use the brain, you lose it. You decline more rapidly without social and cognitive stimulation. So here's a few respite services just to get you started, okay? And that list that I gave you of caregiver services, please have people call them, because they know the whole list across the metro, and we'll share with them, okay? Now I'm going to get into some things that I'm just going to swipe over them so that you know these things exist, okay? Dr. Terry Barkley shared this list with us in a training in September, and I just thought, ooh, I got to get this word out to people, so I'm going to share several. The assistive technology is wearables, sensors, monitoring, tracking devices, smart home devices like door alarms, motion sensors. There's plugs and appliance monitoring, smartphone apps, and medication dispensing services. Do you know there's dispensing boxes now for medication that are all electronic that alarm the person when it's time to take them, and it pops the right door open so they can't accidentally take several different times of day? So know that this could be very helpful. What is the goal? To keep people in their homes as long as safe and possible. And these can be very, very helpful. The next slide is about decision-making capacity. So if with a dementia, as with a dementia, your brain is changing and things are changing as to how you will be able to process things. To be able to make decisions early on as to what you will want later on is it's actually, think about it. It feels good to be able to think about this for yourself and try to make some decisions for yourself. I'm now giving you who does that and how you can get a hold of them to help that person plan. Of all the people I've worked with, not everybody will be on board with making their plan. Some people will deny that they've had this, they deny that they need to do anything about it, and then that's a different set of work that you can do with these agencies that I gave you the contacts for, because they're our specialists that will help you work through some challenging situations. But for those that want to get on board and make decisions, get running with it. Get those decisions made. The next slide talks about legal and financial planning. So you think about this, dementia care is costly. Families, friends often can get involved. Just the level of care that family and friends give without charge adds up to billions of dollars of care in our United States care. So to get your legal and financial papers in order to help for what's ahead for the future so that you can plan for what kind of care you'd like to have is very beneficial. So use that if you can. If you've not heard about the Giving Voice Chorus, I know Elaine here has volunteered with them. They're exceptional. Similar to a group respite, it's all about social and cognitive stimulation in a singing group. And I've known people in there that couldn't sing a note off of one monotone, and they loved that chorus. So you don't have to be a concert musician to be in this group by any means. But again, it's very meaningful, very powerful, and they have volunteers that also help with that. The next slide talks about the mindfulness-based dementia care, and I will tell you that I know of the person that developed this, and I know there was some great intention and thought that went into this. But it's evidence-based, meaning there's been research behind the success of these programs, and it's for the dementia care partners, the caregivers that go through this. It's 8 two-hour classes, and from what, yes, they're now conducted virtually. I've known of caregivers that have done this in person and have raved about how helpful this was for them, but virtually has been where many of them have gone. And if you say, well, I know that this person couldn't do that, can any of your friends circle help them to be able to access this group each time it meets? Can you find a way for them to do this virtually? Okay, the next one is the NeuroWell, I call it a booklet. I know when I looked at it, you can fill it out online as well, and it can be kept online, and you can go in there and update it. But I believe you all have the old address on your sheet. This is the new address, and if you say, Carolyn, I want you to email me this new address so I can access that link, just let me know and I'll send you this new PowerPoint page. I've got a card up here you can get at the end, okay? And those of you that are listening from elsewhere, you're getting the current information on here. But this is a really helpful tool for those that have been diagnosed in mild cognitive impairment, early stage, middle stage, and it's a really nice way to optimize brain health and function. Okay, the next slide is going to talk to us about why is Carolyn telling us that we should be seen early in a dementia journey? Did you know that there are often things that are happening to us that could be reversible? Dementia is not reversible. What if it was a side effect from a medication? Would you want to ignore that and go on thinking you have a dementia and you're going to continue to get worse? Or would you want to get in and find out that it's a side effect from a medication if we just get you off that medication and onto something else? And again, did you see that that means that potentially a person would not have dementia? So get in when there's memory changes to be seen, okay? All right, the next thing that I want to talk about is what those specifically are. So medicines, but also stress, anxiety, and depression can cause what looks like a dementia. Too little vitamin B12 can look like a dementia. Sleep apnea can cause changes for the brain that can look like dementia. Hypothyroid, alcohol use disorder, minor head injury, or brain diseases, whether it's a tumor or an infection. So definitely get in to rule out. That's really what the practice of medicine is. It's a rule out. Let's rule out the worst first. So usually they're going to rule out heart, they're going to rule out kidney, thyroid, all the really critical things first, and then they're going to start digging deeper on other. So please take advantage of your primary and the healthcare system for that reason. The next slide tells you how to get a hold of Teepa Snow information. She's an occupational therapist. She has worked with some medical schools. She's exceptional. I've been trained by her different times. She has a link to her particular website, but also if you go on YouTube, there's multiple YouTube videos out there with Teepa Snow. Teepa Snow is not her legal name. She changed it to become her legal name because her niece couldn't pronounce her name and called her Teepa. And so, but you never forget a name like that, do you? Very good, really awesome person making a difference in the world of dementia. The next thing I want you to be aware of is on the next slide for the Dementia Friendly Airport Working Group. I have joined this group recently. I've helped them in the past. We trained the Minneapolis-St. Paul Airport in February of 24, and a couple of my colleagues have continued doing some work. We may be doing some work with the TSA out in Washington, D.C. in the future. That is yet to remain to be seen. But what they have pulled together is incredible resources for those of us that are traveling with someone with dementia. Highly suggesting you go look at this link. It's even for people traveling local. So really good things to think about. You could easily look at it and say, don't need that, don't need that, don't need that, but wow, I never thought about that. So do take a look. A lot of thought has gone into this, and there are airports across the world that are working on this group. Australia, some from Canada, some of the smaller airports, Phoenix, Arizona. There's just some really great work that's been done on there. The next is one that Dr. Barkley recommended for some caregivers, and so I mention it here. I have not used it personally. Probably because I'm not an athlete, so those kind of references would go over my head anyway. But maybe you or the person, the caregiver that you're concerned for is totally into sports. This could be a really good resource for them in caregiving, okay? The next thing I want you to see is our upcoming sessions. So as I said, we're taking off December. I think we have busy schedules that month. We'll come back on the 14th of December. I had asked for prayers. I'm having a total knee replacement in a week. And so I plan to be up and talking to you in a standing position. We'll meet again in February, and then March, and we'll end on the 15th of April back in the evening. So if you can't make these, look for them for being live streamed or recorded, okay? All right. This is the link to how to access each of these that we are doing each month. So if for some reason that link changes, I'll update it each month, but I believe that is going to be your link to this. So we are having plenty of time to do questions and answers, and I have Michael, who's going to come to you with a microphone, because last time I didn't repeat all questions, and therefore not everybody heard what the point I was making was. So, who would like to ask the first question? Yes, right by you, Michael.
Hello. You talk about being diagnosed with dementia. What is done to diagnose people? What do they go through?
Okay, so what do people go through to be diagnosed with dementia? So it's called a neuropsychological examination. My mother has gone through this and it is a time-consuming process. It was exhausting for her, but the rationale for it is they're asking you questions. They're specifically looking at the function of the different lobes of the brain to see what changes you are currently having. I will tell you from last month, there is now a biomarker for Alzheimer's. It's a blood draw, but neurology is the ones that have to order that, and that's for Alzheimer's disease. But the neuropsychological exam is really the tool for all other dementias, and it likely will be a great tool even for those with Alzheimer's to really get to the where they are in their abilities. Did you notice I used the word abilities? Not in their disabilities, but what are they still able to do? And we want to learn that. So the neuropsychological exam can last 3 or more hours to get through them. Lots of different paper things that they'll answer, questions that they'll verbally answer, things that they'll look at and identify. Let me take you before that, however. The mini-cog that you do at the physician's office is 5 different questions. I work with the Faith Community Nurse Network, and we do wellness screenings around the metro. And with those wellness screenings, they do the mini-cog, and if a person doesn't do well on the mini-cog, they give the person the opportunity to do a MOCA. That's the Montreal Cognitive Assessment, and I do those with people. They're a 30 question, and they're very sensitive to pick up mild cognitive impairment versus an early stage dementia. They're very sensitive. They're not hard for me to give, but they're very helpful as a tool. So that's prior to going in is the mini-cog, either at your physician's office that gives the red flag or at a wellness screening. You will go through a neuropsychological examination.
So after you go through the physicians, should you go to a neurologist right away or contact someone like yourself?
No, if you have gotten where the mini-cog is showing a change, so I'm going to answer this from my perspective, okay? I want to use all the tools that I have available. My mother had Lewy body dementia. My father-in-law had Lewy body dementia. That's complicated. My cousin had frontal temporal dementia. That's complicated. I would get to a neurologist if there's anything that's difficult. If there's behaviors that you just don't know how to work with, I would get in and have neurology work with you, because you don't want, you may receive a diagnosis of dementia, but that's the category. I would like to have you know, do you have Alzheimer's, Lewy body, vascular, frontal temporal, or some other? Because there are medications in some of those categories that you should not take at all. So if you showed up with some extreme type of behavior in an ER and they gave you certain medications, you could have a really extreme reaction. Okay? So I preferred with my family to know what was going on. If things are kind of status quo and memory's changing and there's really not a whole lot of difficult things that are popping up, you may choose not to go on to neurology. But Lewy body is not the average. There's a lot more symptoms, there's a lot more to deal with, same with frontal temporal. So, did that help you?
Yes.
So not everybody will go on to neurology, but I myself would go because I would want to have more details.
So I'm just wondering, say you you have an appointment for a neurologist and they do the assessments. Should you continue to still go to the neurologist like several months later or a year later, or is it not really necessary once you've been there once?
Did everybody catch that question? So the question was, has been to the neurologist, has had the evaluation done, and should I return? And my question would be is, what did they tell you? Did they tell you to set up another appointment to come back? Did they say, we want to see you every 6 months? Did they say, we want to see you every year? Or did they say, only call us when you have trouble? Because I will tell you that for the most part, unless something has changed that I haven't heard of, many of those memory clinics can't function full-time just on their memory clinic work. They have to do other neurology work as well, so the appointments are difficult to come by. So it might take time to get back in, but I know that there's a social worker at one of the clinics that's been incredibly valuable to many of our families, and see, I'd like those tools. But I will tell you, if you don't have access to a social worker at your neurology clinic, I've listed some agencies that have exceptionally highly trained specialists. The level of dementia care that we practice is far more than what your average physician, PA, nurse practitioner has been trained in, because it's a specialty that many never have heard of in medical school. Yes?
I'm not sure if this is something that people here are experiencing, but there's a legality when you're not a relative and you're just a friend or a neighbor. And you see things, okay? So could you give me some ideas of how to help these people? I mean, you can't step in and they force them to go to the doctor. And, you might make suggestions to the person that is the caregiver, but sometimes it gets frustrating. So is there something that for people that see that in the neighbor or see that in a friend and are they able to help somehow?
Yeah. Sorry. I heard all of that. Did everybody hear that statement? What's the legality of helping a friend or a neighbor because you don't have that family connection? And there's a lot you still can do. So I don't know who all of you are that are sitting here. I might have people sitting here that are living with dementia, and I don't want to upset anyone, but I'm going to be honest in my answer, okay? So know that I was a nurse in a church for 9 years, a church of 1,500, and know that in 41 years and 29 years as community nursing, I've had a lot of experience in that area. So if there are in any regard, if the person you're saying to them, I'm concerned for you, would you go talk to your doctor about this? And you don't know if they're going or not, you can take that 10 signs checklist that I gave you. You can write down what you see. If you know which clinic they go to, you don't need to know much more than that. You can put it in an envelope, seal it, and put on there Carolyn Claver's primary physician and nurse, and put your name up in the upper left, and hand this to them, but give your contact information that you're a close friend and you're noticing changes. I don't know, because I've never worked in a memory clinic myself, so I don't know how much they're using the family questionnaire anymore, but it used to be very critical that family give feedback into things, so I'm gonna guess that they're still doing that. But that input will be helpful for the physician. The next thing so you may not ever hear that you've had fruits from your labor, but you may have been able to help a situation. So there's some key things I'm going to ask you to think about to be noting. If you're noticing that their driving is getting dangerous, they're blowing stop signs, they're going the wrong way down a one-way, including Home Depot parking lot, okay? Because I've had volunteers tell me they've seen some of our participants this way and they're worried. So all of that can also be written in that note to the primary, okay? But you may never, because of HIPAA, hear back from the physician, the nurse, your neighbor. If you notice that there is, now I say this out of love and care because of my history with my family with dementias. But if you're noticing unsafe behavior, you know that they've had a frying pan that's totally burnt black because it was left on, that's a huge, huge risk for fire. Is it in an apartment? Now it's a huge risk for the whole entire building. So you can let the building manager know. You can be calling adult protection and reporting as a caring citizen that you're very worried about your friend. This is not the level of I'm telling on a person because I want them to be moved out of their home. That's not what we're trying to do. We're saying we're worried about this person. We don't know what to do. Who can we reach out to? So adult protection is another. I will tell you that calling any of those professional services and talking to any of their caregiver consultants would not be a bad idea either, because there are multiple situations. We had a caregiver in one of our support groups whose husband had multiple guns, and his behavior So the brain is complex, and as his brain was changing, he became very angry and very violent. Right away, I said, what's the deal with the guns? Are there ammunition near the guns, or is it locked separately? Are the guns locked up? Does he have access to it? Can they be given to somebody else in the family? So now, what I told her is she needed to call the police department in her community, let them know that her husband had dementia, let them know that there were several guns in the house. One of our next talks, I'm going to go into detail on some of this, including driving and a driving contract and such. So know that there are things that can be done as a friend. Even though you feel like you're helpless and I don't know what to do, just even the resources I've given you today, reach out to them and ask a question. You don't know till you call. You might say, but I'm the neighbor, they're not going to want to talk to me. You don't know till you call them. And you're worried about the person. So, and think of, yes, she gets ready to ask the next question. I want you to know, think of the situation we're living in now. How many of us have kids that don't live in our area anymore? They live in a different state, different country. Having friends, neighbors, faith community looking out for each other is more important today than ever before. I grew up in a rural community. Everybody knew everybody's business, including on the party line, right? So go ahead.
Okay, that was very, very helpful. Many of us neighbors are concerned about this one particular neighbor, and I've talked to his wife, and he refuses to go to the doctor, refuses to get any kind of help or anything. So what, I mean, yeah, we could probably call the police because he's driving, but I don't know what else we can do except offer her some help if she needs to, reach out. And that's about all we're doing right now is offering her help.
Mm-hmm. So did all of you hear that question? Because the interesting thing with that is you're feeling like your hands are tied as a friend. I'm going to tell you there are many families that feel their hands are tied. In the same scenario as you, dad is refusing or my brother is refusing to go in to see anyone. And I don't know what we're going to do. And again, I'm going to tell you, support groups are hugely helpful. Often the facilitator has specialized training, but reach out to those professional caregiver services because you're an extension of a caregiver. You're trying at least to caregive for the caregiver, if nothing else. And what can be done? Get some ideas so that there can be ideas given to her. Unfortunately, it's not uncommon that a crisis occurs before that family gets help. However, what can we as a society of loving, caring people with a feeling that it's part of our Christian duty to care for those that maybe aren't who they used to be? And if we can help them just before a crisis, we've done a whole lot more. So don't feel that you're banging your head against the wall or that you're not going to make a difference, because you may be able to make a difference. So I'm going to ask you a question, and you don't have to answer it. If he's refusing, if you talk to her, does she wish that he could get help? Yes. So then my next question would be, could somebody go to play Kings in the Corner or some card game of some sort, or go for a walk in the park, or go play a round of golf while she goes to sit down and talk to a caregiver services professional to figure out how to work with this? Because these are things that we have worked with caregivers for multiple sessions to try to get the right help at the right time. This is not a simple disease. This is incredibly complex. Yeah. Don't give up. Don't give up. Call somebody on that sheet if you can, okay? Another question? Yes, up in the front here, Michael. Cream-colored sweater. Yep, right there with the vest on.
Last week, we learned that there was such a person as a medical therapy management person as a part of our clinic. And I was so happy to see your section on reversible memory loss, because this person was very helpful, and she went through everything very thoroughly, and then she took my husband off of very quickly, said, by tomorrow, stop that. Lisinopril, have you heard that as possibly contributing to cognitive decline or challenges?
So is this the PharmD that you're talking about? The pharmacist that took him off?
She's a PhD
Yes.
pharmacist
Yep,
for the
that's
clinic.
the PharmD.
Oh, okay.
Yep, exactly. And she found that she was concerned with the lisinopril that your spouse was on and felt that there was cognitive changes. So you were grateful that that was mentioned so that you could. So what she's talking about is last month I talked about the many things that could potentially cause what could look like a dementia, and by going to a pharmacy specialist that could go through all of your medications, they could then be deciding, is there something that could be making things worse? And she took that advice, went to somebody, and did you find that there's been any help with going off of that drug? That you don't want to answer that to the group.
No, it's not me, so I can't answer
Yeah,
that.
yeah, and that's okay. But what we're hoping is that if there can be one nugget that each of you walk away with each time that can make a difference, then we have made this neighbor less stressed than what they were before. That's what we're hoping. How can we make this? Do you know that 40-some% of our caregivers will die before their person dies of dementia? That's how serious caregiving for dementia is. Do you see why I'm very passionate about this work? Yeah.
And I was going to add that, many older people are given so many prescriptions, one after the other. And when you get 4 and 5 prescriptions, somebody has to be on top of that. And sometimes it has to be the person or spouse or somebody. So that was such a good section there. Thank you.
Really, really happy that that was helpful to you. Yeah, the PharmD, I don't know where things are at with insurance paying for it now. I made an appointment with a PharmD a year ago, and I think it was going to cost me $200 or $300. But at the time, that would have been important to me, and I would have paid it. If my insurance would have covered it, that would have been even better. So this is great that you took advantage of that. Somebody else have a question? Right in front.
One of the frustrations I had as a caregiver is that we had other medical issues that we had to look after, and it would seem like those people never got tuned into the fact that we were in this dementia world also. What's the issue there?
Did you all hear him? So they were in the dementia journey, and as they were going to, the person he was caregiving for had a lot of other medical issues, so he was going to other specialists, but they were not in tune to the fact that the person he was caring for had dementia as well. So, unfortunately, we are a huge medical system with tons and tons of specialists, And as we get further into our specialty, we've spent less and less time studying all the other things, so this is what we know so very well. And remember I said, medical schools haven't been covering dementia. And so they are so focused on the thyroid or the kidneys, and when you walk in, they're seeing that kidney disease, not the whole person. And I'm not going to say that's the case with every practitioner, but think of how I am going to tell you that I don't believe it's the practitioner's fault. I'm going to tell you that I think it's the insurance company's fault, because they've said how fast they have to kick a patient in and out. And some systems, you get docked if you've taken a patient too long. So therefore, they've got to address the issue and get you out the door. And that is not what I went to nursing school for. So I feel sorry that so many people are pushed into having to answer to that. It doesn't answer the fact that you had to keep repeating yourself every time. You probably also had to say that not only is the kidney disease the problem, but now I'm having trouble because I can't always get those medications in, or they're refusing to take them, and then now you're getting outside of the ability of this person because they just don't know how to work with that dementia issue. Am I sort of on the right track with this? Because explain it a little further so I can come closer.
Well, we were working with diabetes is what came up during the process.
Yeah.
And that was kind of the issue that I had to go in and explain over and over again that we had this other issue that was overriding all this. And I was managing all the diabetes controls, so I was familiar with it, but that was kind of the best example.
Yeah, so with diabetes, and that is complicated on top of dementia as well. I'm guessing it was hard to manage the diabetes. Is that correct? Yeah. So, you know, I know from the intense caregiving journey we were on for a few decades, and I was doing it from long distance and caring for young kids, and I had one with a disability, and we were training a service dog on top of it. So what I will tell you is that I know for myself how exhausted I felt and how I felt like I was juggling so many balls, and did I tell this specialist enough information, or did I forget to tell him what was going on with the diabetes? And so there is so much to do as a caregiver. And with dementia, you're oftentimes trying to add to what the person says early on, then trying to maybe correct something that they might have misspoke to the physician or in the middle stages, and then later on you're managing it all. And it's hard. The other thing that's really, really hard, and no one can totally define it for you, is when is it the time that you no longer address all the other medical issues and it becomes time for palliative care and hospice? And that's complicated too. It's hard. I know me, because I was always pushing forward. I was always wanting the best, so sometimes it wasn't obvious to me when we were at that point. But I hope that I helped to explain to others how complicated it actually can be. Anybody else? No other questions? Well, I'm hoping that, again, there was something that you could glean from today. There was something that maybe you heard from somebody else that really helped you. Know that there's hope for this, and there can be joy in dementia. We just have to be a part of that and be positive in how we frame our conversations and communications. So please be well. Happy Thanksgiving to you all. Merry Christmas as we go into this season. I'll see you in 2026. Can you believe I said that? Take good care.